Is it true? Okay. They consult patients, carers, and clinicians to identify their uncertainties, their treatment uncertainties or care uncertainties. So research questions about treatment and care. They then agree by consensus a prioritized list, usually a top 10 research questions, although usually more questions are identified. In our case, it was 83 questions around palliative and end-of-life care. And then we check that no answer to these to the questions is yet available by looking at systematic reviews that have been carried out. We then try to publicize the results of the PSP, of the priority setting, amongst the research community. That's what I'm doing now. And take to research funding bodies. We've pretty much taken them to ourselves and to others. So examples of PSPs that happened was Parkinson's PSP, palliative and end-of-life care PSP, that's the one I led, a dementia PSP, spinal cord injury PSP, and an inflammatory bowel PSP. And in the past, there has been a urinary incontinence PSP that reported in 2009, but we haven't been able to make contact with anybody involved in that since.
Did you try? Because I was one of them.
Were you involved?
Yes.
Well, I saw the paper there, so there's an update paper from 2013, which is very interesting.
Actually.
Excellent, yeah. So let's talk after.
Okay, good.
So what, that threw me. So what did we do? So we found that incontinence was highlighted as like a cross-cutting theme in a number of our priority setting partnerships. And so we decided to go back to patients, carers, clinicians, and researchers to find out what we should do next. So we had a workshop at the end of last year. We had a number of morning talks by some eminent people in the room, Mark Strake, Luke Whale, and a PPI representative, patient and public involvement representative, well known in the UK, Derek Stewart. And then in the afternoon, we had breakout groups to hear about the experiences of patients, carers, and clinicians. So here are some of the messages from the workshop. Incontinence is a major issue affecting people's quality of life. I don't have to tell you that, but I have to tell a lot of other people that. So here I'm probably preaching to the converted. We had someone saying, my bladder and bowel own my life 24/7. In spite of this, continence issues are rarely discussed in consultations, and interesting to see the talks early on. With GPs or other healthcare professionals, there's often, in a 7-8 minute consultation, there's often not enough time. You want to get the first, the initial, the problem around Parkinson's out. You don't get to the incontinence. There's a lack of awareness of sources of information and advice. And people have said, with incontinence, you are on your own. And devices and implements are often not practical or well designed. Carers told us the dignity of incontinence was worse than the illness that caused it. There's a lack of staff time in hospitals and care homes, can lead to people being catheterized by default, and that means they're often catheterized for a long time. A lack of specialist continence nurses, at least in the UK, a lack of training for generalists such as GPs, nurses, and healthcare assistants. And I know that certainly training for GPs was highlighted in the urinary incontinence PSP, and not much seems to have happened since. And there's a lack of non-drug and non-surgical interventions aiding self-management, and that's what patients and carers really cried out for. They wanted to self-manage their incontinence. They wanted to know what was effective, and they were doing it anyway, but they were sharing it via websites or other means. And the last slide, some of our recommendations. We think there's a need for a health economic analysis of the impact of continence issues in the UK. To show how big the problem is and how much it costs and to whom. We need more research to design and test non-drug and non-surgical interventions that promote self-management. Researchers should involve patients and carers when designing and carrying out research studies. And although it is very much a taboo subject, we have, in the workshop, we saw that patients were actually quite happy to talk about their continence issues. We were surprised by that, and it's a really good step forward. So we're encouraging researchers to involve patients and carers. There should be a single knowledge hub of information and advice. There used to be one, the Blood and Bowel Foundation in the UK, that folded. There should be a national awareness-raising and education campaign. You don't have to suffer with incontinence just because you're getting older. There might be ways to treat it. We need more and improved training and education for health and social care professionals to deal with continence issues and support self-management. And we need research to develop them and then to test them. And we need more research funders to support the area. So we had it as a highlight notice in our Marie Curie call last year. So we've got, I think, 2 applications. So that's one step forward. Thank you.
Thank you. Paper is now open for questions. Yes, please, if you'd like to come to the microphone, Lynn.
Good afternoon, everyone. My name is Lynn van Poelgeest, WFIP, Netherlands. I just want to say, Blood and Bowel Foundation has folded, but there's Bladder Health UK. So please, there are very active continence organisations and bladder health, not just in the UK, but worldwide.
Yeah.
So just to point that out. Thank you.
I have a question. So, you know, I'm not surprised by what you found and the needs, but it's, you know, we've been saying this for quite a while. So I guess, you know, funding isn't there, right? So what is the solution? I don't, you know, I mean, we see the same thing in the U.S. with an aging population. And
well, I think one of the I think that's why the thought of having an economic analysis first to actually show how much the NHS in our case has to pay for continence, how much carers have to, and the patients themselves have to pay. And it's interesting to see this morning an analysis in Italy, and it's just not done. And I'm surprised it hasn't been done. So that's the first step. And then clearly, I think it's an advantage that we are research funding bodies ourselves. We have links with the National Institute of Health Research, Devices for Dignity. So it's the James Lindeline's partnerships are one way to highlighting these issues that are raised from patients and clinicians, actually.
Fair to say that the last PSP, which identified the top 10 research problems, did have quite a lot of bite. There were funding announcements as a result, and I think at least 4 or 5 of them got funded nationally.
The urinary incontinence one, yes.
Yes, so yes. I think that this is a great potential for people in other countries to get on board with this kind of thing. Immense power if it's seen as coming from patients. Thank you very much.
Thank you.